All right, good morning, everyone. This is Elizabeth Anderson Hoagland with the Tobacco Prevention and Cessation Program. I'm going to apologize ahead of time if I start coughing. It's allergies. I'm on 2 different allergy medications and it's still not enough. So I'm sure you all understand everyone in Kentucky has allergies. I'm going to go ahead and get started in just a few minutes. I do have a couple of announcements first. One, this Saturday in Lexington at a community event, a small local organization is going to be, they're doing a cookout for the local kids. And they are being sponsored by RJ Reynolds. And RJ Reynolds is doing a talk to the kids about preventing initiation of tobacco products. Um, so this is the second time in the past 6 months that we've heard about a tobacco company doing direct outreach to youth and families in Kentucky. So obviously, that is still a tactic that they are doing. That's still something that they are working on. And I don't know if they're increasing their efforts in the state or if I'm just hearing about it more now. So my ask to everybody is to keep your eyes and ears open. If you hear about community organizations or breakfasts or lunches or any types of educational and outreach by the tobacco industry, please let me know. I can help you strategize about how to handle that, about how to work with the community, how to try and mitigate any damages. I will say in the case of this group in Lexington, I reached out to them and they were not incredibly interested in hearing what I have to say. And that might just be what happens. Just as a quick recap, why we don't support tobacco industry sponsored educational curriculum. One, the tobacco industry emphasizes the role of peer pressure and peer influence in young people using tobacco products. They do not talk about things like nicotine addiction, about marketing, about sales and pricing, about flavors, about point of sale advertising, or about anything else that the tobacco industry has done to target youth, which we know they have targeted youth. We also don't support this type of educational outreach because a lot of times it is actually marketing about the products they have. They will go and they say, here's this new tobacco product that we're putting out. And they don't really talk about how you shouldn't use it. They talk about how it's an adult choice. Well, if you're a teenager and you hear the phrase adult choice, you think, well, I'm an adult. I can choose to do that. I can do whatever I want because I'm an adult. And finally, we know that a lot of times the tobacco industry uses this as a way to buy community support and to try and reduce support for anti-tobacco measures that we know are effective. So if RJ Reynolds is going in and speaking to these kids about tobacco use, it makes them look like good guys to the adults, so maybe adults are less likely to support increasing taxes on cigarettes, or less likely to support prohibiting flavored tobacco product sales, things that we know are effective with young people. So that's a long-winded way of saying if you hear about the tobacco industry trying to reach out to your community, let me know. We definitely want to stop that and get ahead of that, and I can help you work on that. The other thing I have to say is if you have any ideas for topics or speakers that you would like to hear for the tobacco coordinator calls. I think this is like the fourth one that I've done over the past year. And I'm sure I have a lovely speaking voice, but you might be tired of hearing it. So if you have any ideas or topics, please let me know. You can type it into the chat box here, or you can send me an email or give me a call, because we're always looking for new ideas. As you've seen this year, sometimes we're able to get speakers from out of state. So, don't let something like that restrict you. So far, everyone we've had speak has been free, which we appreciate. But if you have any ideas, let me know and we can see what we can work out. So, the topic of today's webinar is how to write grants that will get you funded. I will say that I have been writing grants for 10 years now, and I have been in a position to grants to be the person giving out the money for about 7 years. maybe 8 years now. So there are people out there with more experience than me, obviously, but I do have quite a bit of experience in grant writing and grant funding. And I've worked with government institutions, I've worked with private foundations. So I've seen kind of the way a lot of grants work. So the templates and the examples I'm using here are going to be from the local grant applications that we send out, but they are going to be applicable to other types of grants that you might be applying for. And I will say, if you are writing for a grant for your tobacco program or your tobacco work, even if it's not to us, if you're writing to some outside entity, feel free to touch in with us and ask us for help. We're absolutely happy to provide that. We really want you to get a lot of money so you can do great things and do great work across the state, so that RJ Reynolds gives up on trying to, bribe kids with meals. I will also say, when it comes to the local grants, we have a certain amount of funding that we're able to give out. So while the title of my grant is How to Write Grants That Will Get You Funded, unfortunately, if all 61 local and district health departments write absolutely phenomenal grants, we're not going to be able to fund everybody. And this year we had about twice as many grant applications as we have had in previous years. So some of you wrote great grants and you still didn't get funded, and I apologize for that. I wish I had millions of more dollars that I could give you, because frankly, you all are doing some great stuff out there. So that is my caveat for my title of this presentation. But I do believe that the tips and tricks given in this presentation will increase your chance of being funded in the future for other grants. So with all that said, let me go to the next slide. Excuse me. I'm going to have to, like I said, I'm going to be coughing a lot. So this is just a general overview. When you get a grant application, as someone who's on the end funding, what do I want to see? In general, I want you to tell me a story. I want you to tell me your story. I want to hear about your community, about what the problem is, and what you're going to do to solve it. So what I do want you to do is provide specific data and information on your community. You can tell me what the smoking rate is in the United States, and that's nice, but I can really look that information up myself. So you need to include specific information about your community. What is your county smoking rate? What is your high school smoking rate? What is your middle school smoking rate? And if you have problems getting that data, you can contact Lara Daniels, our epidemiologist, and she'll help you figure out your statistics for your particular community. I want you to connect the dots to show how your activities will help the problem. So if your problem is that kids are using Juul products in schools, then tell me how your advertising campaign is going to address that. Like, there are certain things that I know because I've been doing tobacco work for so many years, but I also need you to show me that you know that what you're doing is going to help solve the problem. Connect the dots for me. And sometimes it's not something that's going to be intuitively obvious for someone who's not in your community. So I really need you to make those connections for me. And then finally, the last do, and maybe the most important do, is read the instructions. The local grants that we give out every year generally are fairly similar instructions-wise, but it's still important to look through and make sure that you're reading them, because there are some things we allow, there's some things we don't allow, and you want to make sure that you are not putting unallowable expenses or unallowable activities into your work plan. If I am asking for information about evaluation, make sure you include information about evaluation. As someone who's the funder, I want to see that you're able to follow directions to make sure that the funds are being expended in a way that they should be expended, and also that you're likely to be able to, make a difference in your community. The do nots. Do not gloss over relevant information, even if it is not favorable. Let's say you've done a great job and your smoking rate in your community is lower than the smoking rate in the state. Don't gloss over that. Like, tell me that's what's going on, because I'm going to notice. And then explain why you still need the funding. Yes, we're lower than the state, but we're still having worse health outcomes. Or yes, we're lower than the state because we have done A, B, and C. And if you let us do D, I think we can drive this rate even lower. So if your data is good, like that's a good thing. Don't try to hide that. Also, there are a lot of you who are working in really difficult local political climates for getting policy change. And we have been with you every step of the way. So don't hide that. Like, we're gonna know, like we know the background of your community if we've been working with you for a while. So don't try to gloss over that information. Instead say, this is our roadblock. This is what we're gonna try to do to get around that. And, you know, we're willing to help you work on that because some of you, like I said, are working in very difficult environments. Do not be vague on how you will achieve what you want to achieve. I know there are those of you out there who do great work and you know exactly what you need to do, but I need you to be able to tell me because I have to be able to turn these grants into my boss and they need to be able to turn that into their boss. And we need to be able to show this to, say, the secretary's office or to the legislators and say, this is what we're doing in the local community with our local grants. So we need to be able to know exactly what you're doing. And that helps us evaluate your project and say, you know what, they've got a great plan. I really think they're going to be able to get it done. I really think this is going to be able to make a difference. As opposed to a grant which is more vague where we're like, we're not really sure what they're trying to achieve. So how do we know that they're going to be able to be successful? And the final do not, and this is going to come up a couple of times, don't try to get around the instructions. If you have a question as to whether something is allowed or not, just go ahead and give us a call or send us an email. And I will say, when we've worked with the CDC on grants, if we have questions, they are very responsive. Anyone who's a funder, or who's a good funder, I should say, tries to be responsive. We try to make the instructions easy anyway, but if they're not easy, just ask us and we're willing to help figure that out. So I'm going to be going through some examples using our local grant template as a guide. And I'm going to be showing you good examples and bad examples. So this is a bad example. Sunshine County has school population of estimated 4,147 youth according to the KY Health Facts, which all are exposed to secondhand smoke and or e-cigs vaping while on school grounds. The total population for Sunshine County is 15,000. With the assistance of the Grant Tobacco Prevention and Cessation Program, Sunshine County Wellness Committee will reach at least 5,147 households with benefits of being tobacco and or vaping free. 15% of population has asthmas and 35% are smokers in Sunshine County. At least 8 different educational materials will be sent to the homes of all school-aged children, backed up by community media, radio spots, newspaper ads, billboards, and health fairs. So this is an application we received a couple of years ago, and I have tried to make it anonymous, and I apologize if whoever's reading this right now is like, oh, I think I wrote that. It's okay. We can make this better. I'm going to show you a better example in the next slide. So the first thing, we got 31 grant applications this year, each which are multiple pages long. It's a lot for us to read. So the easier it is to read the information, use your good grammar, use the good language to make it easy for us to understand. I don't need you to write something that's going to win a Pulitzer Prize. I just of grammar so it's easy for us to understand. Also notice that this is a little bit jumbled up. So we start out talking about the problem, and then we talk about what we're going to do, and then we talk about, you know, some statistics, and we talk about what we're going to do. Try to go in a logical order. So here's the background of our community. Here's the problems that we're having. Here's what we're going to do about it. And finally, notice that there's not a lot of specific information about the problem. So we know how many youth are there. We know how many people have asthma and the smokers, but we don't know. They're addressing secondhand smoke exposure in the school grounds, but they don't actually talk about that. We don't have any data about that. And maybe you don't have specific data about that. What information do you have that makes you think that's a problem? Are you hearing complaints from the students? Are you hearing complaints from the parents? That's information you'd want to put in the background. Excuse me, taking a drink. So let's contrast this with a good background. For many years, Sunshine County was the home of Big Tobacco. Companies like Cancer Inc. were among its top employers. In 2017, approximately 25% of Sunshine County adult residents and 6% of adolescents reported smoking. According to local survey, smoking has been declining among students from grades 6 to 12. However, this data is not inclusive of e-cigarettes, which among young people has surpassed the use of conventional cigarettes. Then they have their citation. While the percent of Sunshine County residents who smoke has decreased from 32% in 2008, adult residents still report smoking at rates higher than the national average of 15.1%. Not surprisingly, Sunshine County has high rates of cancer and cardiovascular disease. About 511 Kentuckians per 100,000 have cancer, which is the highest in the nation. Sunshine County's rate was even higher than the state average of 524 per 100,000. Citation. So what makes this good? One, there's good grammar. It's easy to read. It flows well. Two, they have their data and they have citations for their data. Citations is good. If you tell me that 6% of adolescents are smoking, I want to know, how do you know that? So just tell me. And notice how in this county, they actually have some good data. I mean, they're doing better than they're doing better than Kentucky, but they're still doing worse than the national average. So they're showing me their data honestly, but they're still showing me that it's a problem. And I will note when they're talking about e-cigarette use among youth, they're talking about potential problems in their survey data, which is something we've been talking a lot about here at the state. When we look at e-cigarette use and the KIP data and the Youth Risk Behavior Survey data, does that include products like Juuls, which, if a kid says they're juuling, do they know they are vaping? Let's talk about goals, your goals for your grant application. We are so lucky in the tobacco control realm because the CDC gives us our goals. So you can pretty much just take one of the 4 goals of a comprehensive tobacco program and plop that into your grant application and just apply it to your county. And that's good. We are very lucky because not every program has such an easy road mark. For those of you who are doing things like obesity prevention, there's no 4 goals that are really easy for you to say, well, this is effective if we just do this. We're lucky in tobacco. The one time we're lucky. So when we're looking at our goals, our first is a bad example. Continue to promote 100% tobacco-free schools in the Sunshine County school system. So your goal is your big overarching change. What do you want to see change in your community? So if we want to promote tobacco-free schools in the county school system, why? Why do we care about a tobacco-free school policy? You're like, well, because we want less kids to smoke. So that's the actual goal. The actual goal is we want fewer youth to start smoking. Or maybe our goal is secondhand smoke. We want to reduce exposure to secondhand smoke. That's fine. But that's the overall change of what you want to see happen. So there's our good goal. I just said it right below, the reduced exposure to secondhand smoke in Sunshine County. That's what we want to see happen. That's why we ultimately care. And you might say, Elizabeth, that's not very specific. And we're supposed to be specific in a grant application. And you are in your objectives. You don't have to be all that specific in your goals. And we're going to talk about objectives. And objectives is what are you going to do and what is that going to change? And you've probably heard us talking about SMART objectives before. Specific, measurable, achievable, relevant, and time-oriented. So specific, what policy, class, or activity will occur? Measurable, how will you track what happened? How much will change? Achievable, can you really do it? I mean, I could write a grant application where I say, I'm going to eliminate smoking in Kentucky over the next year. Is that achievable? No, it is not. Relevant, will this thing you are doing make your goal happen? So if we want to reduce initiation of tobacco use by youth, promoting the quit line isn't necessarily going to do that. That would not be a relevant objective for your goal. And time-oriented. What timeline are you going to do this in? Obviously, with the local grants, you have 1 year to kind of get stuff done for that grant application, but you can have longer term objectives. You can say it's going to take us 5 years to get this done, but this is what we're going to do in the meantime for this year. Or you can have shorter term objectives. Maybe you're going to do an advertising campaign that's going to be 6 weeks long. So that is going to be your time orientation. So I'm going to show you some more examples. So our bad example, to increase the awareness of Sunshine City's smoking ordinance via signage at parks. So let's think about that. First of all, I'm going to tell you, awareness is one of those words that really bugs me because it's so vague. What exactly do you mean by awareness? Do you mean knowledge? Do you mean knowledge of the ordinance that requires parks to be smoke-free? Do you mean behavior? Do you mean, are people going to follow the smoke-free ordinance? Are they going to obey the ordinance? So you want to be objectives are specific, so be specific with this. What do you want people to do about the smoke-free ordinance? How do you know awareness increased? You're like, well, I put up signs. Do you know people read them? Do you know how many people read them? How are you going to measure that? And what kind of change do you want to see? Which kind of goes back to my complaint about the term awareness. I mean, obviously what you want people to do is to stop smoking at the park because you have an ordinance there. Another bad example, continue to see a downward trend in adult smoking rates in Sunshine County by end of fiscal year 2019. So what are you going to do to create this trend? So you want smoking to go down. Well, that's fine. We all want to do that, but that's also your goal, is to reduce smoking rates. What are you going to do? What activity, what policy, what class are you going to do to get that smoking rate to go down? And how are you measuring it? We don't actually have any numbers here. We didn't have any numbers in the first one either. So what is the baseline? Is your smoking rate 25% now and you want to get it down to 24%? Do you want to go lower? Is it higher? We don't know. And that's, for someone who's funding this, it makes it really hard for me to look and see where you are as a community and to see if the actions and the steps you're taking are going to be effective. So I'm going to have two good examples. By the end of fiscal year 2018-19, the Sunshine County call volume to Kentucky Quit Line will increase by 10% over the baseline of fiscal year 2017-2018. This is good. They don't give me their absolute numbers. I don't necessarily need absolute numbers, but they're giving me the amount of increase. And they're telling me specifically what they want to see happen. Good example, increase the number of freedom from smoking facilitators in Sunshine County from 1 to 3 in fiscal year 19. This is fine. We don't have to save the world with all of our objectives. We're going to have more people trained who can provide freedom from smoking classes. This is when we're going to do that. Looking at the work plan, and I'm going to tell you, I spend a lot of time looking at work plans and evaluation plans and budgets. This is kind of like, those are like the meat. Everything else is like the window dressing. This is the meat of what you're going to be doing. And I see that I have a hand raised and a question, so I will look at those, and, well, maybe I should look at them now. Let's see if I can open the questions pane. Okay, someone said they're having audio problems. Is anyone else having audio problems? If you're having audio problems, how would you let me know? Okay, she said she got it fixed. Thank you, everybody. All right, I'm gonna minimize that screen again. Okay, so when looking at the work plan, like I said, I spend a lot of time looking at this because this is where you're really telling me what you're going to do. So we have our actions and our steps, our key partners, our outcome measures, our timeline, and then the right-hand side, that's where you update me on your progress over the course of the year. So you leave that blank when you're turning in your grant application. And then as the year goes on, you provide information about what you've accomplished there. And we try to keep the updates and the progress updates as brief as possible. We know that you're busy. So in this case, the first action step we have is design and place social media advertisements. Our key partners are the local health department and ad agency. And the outcome measure they have is increased call volume to Quitline. And the timeline is 2018. Now you might guess that this is a bad example because I have no written in bright red. And as the outcome measures where people generally have problems in doing the work plan, because you know, I've kind of talked a lot about being specific, so I'm not going to be too redundant there, but you know you need to be specific with your steps. And you know who you're going to be working with. I mean, you guys all know your partners like the back of your hand. So with the outcome measure, this is the outcome measure for what your action step is. It's not your overall action. It's not your overall outcome. It's your outcome for this specific step. So if your step is design and place social media advertisements, what is your outcome measure going to be? The number of media placements that were designed and placed. That's going to be your outcome measure. So you can see that on the second line, number of social media ads placed. So when it comes time for you to update your progress with that first line, what would you update there? Would you update an increase in number and call volume, or would you talk about the ads that you placed? Whereas with the second line, you know exactly what you're supposed to be reporting in. You're going to be reporting on the number of ads that were placed. It reduces confusion, and that's just what we're looking for. We want to know how you know you're accomplishing what you said you were going to be accomplishing. So we look at the next line, the youth taking down tobacco training, your key partners, you know, the school district, Campaign for Tobacco-Free Kids, all of that. Your outcome measure is decrease initiation, but again, that's not correct. This is the outcome for that specific action. So your outcome would be the number of youth trained in taking down tobacco from that school district. And so then your period progress update would be you had 45 students completed the first module. Let's see, someone asked if we could have a copy of these slides. Yes. I will say I can send a copy of these slides out, and also this is being recorded. So with the next monthly memo, this recording will be sent out. You're just all going to have to hear me ramble on at the beginning about RJ Reynolds. The evaluation plan. Evaluation is hard. I really get that. We all get that. Evaluation can be very, very difficult. Sometimes it's easy. I mean, sometimes it's obvious what you're evaluating, but sometimes it can be difficult. So again, please feel free to reach out to us. If you go back through your monthly memos, because I'm sure you save every single one in a very special folder just for me, but Emily Farrell spoke in December of 2017. She did a presentation about evaluation that was very good. And if that's something you all would like to have repeated, let me know and I can arrange that with her again. So looking at our evaluation template, we have your evaluation question, your outcome measure, your method, your data source, your frequency, and the responsibility. So your evaluation question, really all evaluation is you're asking and answering questions. Did this happen? Yes or no? How do you know that it happened? Our outcome measures, again, you're looking at the outcome of your evaluation question, not the overall grant application. Your method is what type, how are you, see, I told you it was kind of complicated. So are you doing a survey? Are you looking at ticket sales, like in this example? Are you looking at sales of something? Are you looking at placement of something? Are you looking at ads? Are you looking at numbers? Your data source is where you're actually getting the data from. So looking at method, if your method is a survey, your data source might be the Youth Risk Behavior Survey, if that makes sense. If your method is, if your data source is the Quitline call volume, then your method would be, you know, the data and statistics kept by the Quitline. Let's see, Stephanie, I'm going to answer your question in just a minute. I'm going to get through this section first. So let's look through our examples here. The first question was, awareness of the effects of tobacco use increased in youth and adults? So you've already heard me rant about the term awareness. Like, what exactly do you mean by awareness? So their outcome measure increased community awareness of youth and adults. I mean, that is it's not a great evaluation question, but that is the outcome measure. The method is cinema ticket sales, and the data source is number of patrons in attendance at the cinema. So in this case, that's not actually what you're measuring. Your question is awareness of the effects of tobacco use. But that's not what you find out with ticket sales and people who were at the cinema. What you find out are the number of people who were exposed to your ads, which is a different question entirely. If you wanted to know awareness, or if you wanted to know level of knowledge, which would be a better question, the knowledge level in the community about the harmful health effects of tobacco use, you'd have to do a survey. You'd have to ask them, because people could go see your ads and they could not learn a thing from it. People could go see your ads and they could not have any awareness raised about anything. They've just been exposed to your ads. So those are two different questions. Our next line, how many classes were offered? The outcome measure, how many participants did we have? The method, freedom from smoking. The data source, reports from outreach workers. So this is not correct either. So I believe for the evaluation question, they're probably asking about freedom from smoking classes. And they want to, their outcome measures, how many participants do we have? So you can see they already have two different questions going on here. Are we looking at number of classes, or are we looking at number of participants? Those are two different questions. The method, they have freedom from smoking. That's a class, that's the type of class you're giving, but that's not your method for how you're figuring out your data to answer your evaluation question. Your method for participants would be your sign-in sheet. And again, your data source in that case would be your sign-in sheet, because you could measure the number of people who participated in the class. Now, if you want to know how many classes were offered, then your method would probably be like your calendar, and your data source would be your calendar. And if you wanted to throw in something for us, you could attach a document that had, your advertising campaign, just so we could see what you're doing. So let's look at two good examples. Your evaluation question, were social media ads placed? The outcome measure, number of social media ads placed. Notice how these two questions, they reflect each other. So the outcome measure reflects the evaluation question. The method is social media data reporting, because all of these different social media platforms have their own data reporting. So the source is the social media platform. They're the ones who are giving you the data for how many people are looking at your stuff on their social media platform. We're so happy that social media does that for us. And then our frequency and our responsibility. The final one, did school board members increase support for 100% tobacco-free school policies? The outcome measure, school board members supporting the policy. The method in this case would be the in-person interview. You'd go and you talk to each school board member and ask them, do you support a tobacco-free school policy? Yes, no. Your data source would be your interview notes, because of course you would keep notes, you just jot something down. And if you do this all in your head, just pretend for me that you jot something down. We always like to have things written down. How often would you do this? Maybe once per school year. We don't want to harass them. And the responsibility, maybe it's not you who are doing this, maybe it's one of your coalition members. Now, there was a question. Let me pull it out real fast. Someone asked, how can you find statistics for the quit line to provide, like if you say there's going to be a 10% increase in calls, how do I know that for my community? That is where you get in touch with Lara Daniels, our epidemiologist, and she can give you your quit line call volume. And I would talk to her about what's a reasonable time frame. There are some counties that like to get their data monthly, if she's able to do that. Maybe you want to look over the course of a year. Just see if it's increasing from year to year. If you're running a specific ad campaign, maybe you want to see if your quit line call volume increases while that ad campaign is going on. All of that, just talk to Lara and she'll talk about how she can get that. She'll help you figure out when and what kind of data she can get you. So something else about evaluation. A lot of what we get in our grant applications are process evaluation questions. So a process measure looks at how much you did something. So the number of ads, the number of meetings, persons counseled. But we also want you to look at outcome questions. So an outcome looks at what actually changed. So maybe 60% of your freedom from smoking participants were smoke-free at 6 months. So you see, that's not, this is how often I did something. This is a question about what changed in the community. So a process measure might be, how many events did we exhibit at? The outcome measure might be, has compliance with the smoke-free policy increased? Now, you're saying, Elizabeth, you want me to be specific. How would I measure that? There are lots of ways you can measure that. You can look at tobacco litter. You could do observances of hot spots where people usually smoke, and you can go there for half an hour every day for a week before the policy passed and after the policy passed to see if there are fewer people smoking there. If you live someplace that gives citations for smoking in non-smoking areas, are there increase or decrease in citations? And then another outcome measure, smoking prevalence of disease, etc. And those are longer term. So the course of one local grant, you're probably not going to impact the number of people getting lung cancer in your community. You're probably not going to see that over 5 years, maybe not over 10 years. That's like a 20-year goal, that you're starting to see reductions in lung cancer. So that's something you want to keep in mind in the back of your head. That's ultimately what we want to do, but you're not necessarily going to be able to measure that in the course of one grant year. Let's see, a question, is a social media platform the number of people reached? It could be. When you're looking at social, let me go to the previous page. Oops. Okay, so when you're looking at like the social media platform, you can look at number of ads placed, and you can look at number of people who were reached with the ad. You can also look for engagement. How many people liked your post? How many people shared your post? How many people commented on your post? And frankly, in the tobacco world, we don't necessarily get a lot of engagement with our social media platforms unless there's a really controversial issue. So Terry has been following the smoke-free public housing issue on social media, and people have a lot of opinions about that. So for a hot topic issue, you might get a lot of engagement, and you can get statistics about that engagement from your social media platform. So our Facebook page tells us, how many people were exposed to any ads that we played. They'll tell us how many people like our page, how many people liked our post, how many people shared our post, how many people commented on our post, and then they have some other metrics and data. And so just go ahead and look at that. Maybe Google some of those terms if they sound a little confusing. Any social media, they try to be helpful for people who are purchasing things. Like if you're purchasing advertising, they try to be helpful with that. But there's also a lot of experts on social media, and I am not an expert on social media, so you kind of want to go to, for any questions like that, you probably want to go to someone who's more knowledgeable than myself. When I read grant applications, I'm not going to lie, I look at the first page where we see who turned it in, and I read the little description of what they want to do, and then I flip to the budget. And I look through the budget to see if it seems reasonable and what people want to spend money on. Because you're not just writing to tell me what good ideas you have. You're writing because you want money. You want money to put your good ideas into action. So the budget is extremely important. You will note that I do not have a good budget and a bad budget here. I just have the same phrase repeated 3 times, read the directions. And if for some reason the directions aren't clear, go ahead and ask us and we can clarify. And sometimes we have to get clarification as well. With our local grants, they're usually funded through the CDC, which means we have some funding restrictions that are passed on to us from the CDC. Those are federal restrictions about how federal money is spent. We know that it's silly sometimes. We do know that it's silly. We actually have our CDC site visit tomorrow, and we can't buy food from our CDC money to feed our project officer from the CDC because that's not allowed. But when we have MSA funding, we have a little bit more flexibility. But most of the time, our local grants come from the CDC funding. In addition, sometimes there are restrictions put onto the grants that we put on there. And one of those is the no incentives. Now, you can argue that that might be a little harsh, and there are times I would agree with you. Incentives can be important. You know, we do giveaways at the state fair and stuff like that. But we also see a lot of grant applications over the years, and we had health departments writing in grant applications where they wanted to spend their money on was pencils and rulers and posters and stuff like that. And we know that's not effective. We want you to spend your money on effective activities. If you need additional funding for the fun stuff, and sometimes you need fun stuff, we do ask that you try to take that out of your MSA funding. And, you know, that's talking about our local grants, but this goes with any grant application. They're going to be very picky about the budget because it's all about money, and they have to be, you know, they have to be responsible with their funding, and they have to be accountable to their funders or to their board. So read the directions when it comes to the budget. So what if you want to know more? This is the only picture I have in this presentation. I'm sorry, it's kind of boring. And yes, I've been singing this song to myself for a week now. These are two sources that I really like. One is from GrantSpace, and one is from the Community Toolbox. GrantSpace is good because it's a lot about, it's all about grants. It's just all about grants, both from private funders. I believe it's associated with, I think it's called the Foundation Place or something like that. And the Community Toolbox is something that you are probably familiar with. You've probably used in other sources. And then finally, here is my contact information. Which you guys probably all know how to get hold of me. I'm actually going to go back to this page in case you were writing down any of these websites or these titles so you can find it. So that is the end of my presentation. I am going to pop up the question slide, and oops, it's going to pop back on me. So if you have any questions, go ahead and type them into the question box now. I'm probably covering up that. There we go. Like I said, I know grant writing can be complicated. The only reason I feel somewhat confident about it is I've been doing it for so many years. If you have any questions, if you want help, just go ahead and ask us. We're always happy to help. If you have any specific questions about this presentation, go ahead and send me an email or call me. Maybe don't call me immediately. My voice has to recover. And I'll be happy to provide any more input. I will send these slides out, and I will, this presentation has also been recorded, so if you learn better from hearing someone talk, you'll be able to get that in the next monthly memo. We'll have the recording. I believe our next webinar is going to be in September. I don't remember the exact date, and I believe we're going to have Dr. Amanda Fallon Bennett talking about substance abuse, opioid abuse, and tobacco use, and why when you're trying to get sober from other drugs, you should also quit smoking at the same time. I think that's something we're all very interested in. Amanda has great information, and I believe that's going to be in September. It might be in October. We're going to confirm the date. But in the meantime, please give me any ideas for what you'd like to hear on these webinars so you don't have to listen to me for another month. With that, thank you all very much. Have a great day.